After weeks of complaints about the federal vaccine rollout and the lack of communication with states, Joe Biden is promising change.
From this week forward, God willing, we'll ensure that states, tribes, and territories will now always have a reliable 3-week forecast on what the supply they're going to get. This is going to help make sure governors, mayors, and local leaders have greater certainty around supply so they can carry out their plans to vaccinate as many people as possible.
Biden said tonight he'll be giving states 10 million doses a week. That's 1.4 million more than they're getting currently, and he's upping the U.S. vaccine order by 50%, aiming for 100 million more doses each from Pfizer and Moderna to be delivered by midsummer. Here in Massachusetts, the next couple of weeks will tell whether the changes Governor Charlie Baker announced yesterday will make it any easier for people to get vaccinated, including making people 75 plus eligible for their shots as of Monday, bumping up those 65 plus to be next in line after that, along with people who have 2 or more chronic health issues that put them at higher risk. He's also expanding vaccine sites statewide, and then there's the addition to the state webpage that lets people find a site and register for an appointment if they're eligible starting tomorrow. Still, when pressed on why the rollout here has been so much slower than every state around us, the governor stood by his approach in focusing on getting vaccines to the most vulnerable populations first.
I get the fact that by choosing a number of very targeted communities and populations that we felt we should start with, that would create a slower rollout and a slower ramp up than you would see where you just took big groups by age and said, go. But I do believe at the end of the day, we made the right decision out of the gate.
And when I asked whether there might be more room for improvement or further streamlining of the process on that state's website.
How much more streamlined would you like it to be than that?
Well, I'd like it to include a pre-registration element, as several other states do, where you can sign up anytime, and then it alerts you when your turn is up and where to go to get a shot. We asked the Mass Department of Public Health and Governor's Office today whether anything like that might be in the works, but as of this taping, no one's responded. I'm joined now by State Representative John Santiago, who's also an emergency room physician at Boston Medical Center, and Bill Walczak, columnist for the Dorchester Reporter, who's been banging the drum for weeks about how Massachusetts should be leading, not trailing, on mass vaccinations. Bill's also the founder and former CEO of the Codman Square Health Center and the former president and CEO of the South End Community Health Center. Gentlemen, thank you so much for being here. I appreciate it.
Happy to be here.
Doctor, starting with you, yesterday's actions by the governor, expanding who's eligible for a shot, increasing pretty dramatically the number of vaccination sites, I think to 165 by mid-February. Did that mitigate most of your concerns about the rollout?
Well, look, I think there are a number of physicians and public health leaders across the whole city and Commonwealth that have been asking for this for a while. It's not just a matter of the number of sites, but I think increasing eligibility as well. If you look what's happening across the country, that's what's happening. I mean, the fact of the matter is we still have a whole host of number of vaccines still not being used. And so we need to get our distribution up. And by increasing eligibility, we can get there.
I want to talk about those unused doses in a second. But, Bill, in your piece in the Dorchester Reporter, you were doing some math for us and suggesting at the current rate it would not be the middle of 2021, but rather the middle of 2022 before everybody in the state got vaccinated. But yesterday, the governor talked about by mid-February increasing capacity to more than, I think it was something like 40,000 a day, and based on the supply we get from the feds, the ability to actually vaccinate up to 25,000 a day. Does that address your concerns?
Well, it's a step in the right direction, but it's not sufficient for us to be able to have Massachusetts residents all vaccinated by September. We're not even talking about the spring here. It's we need 420,000 doses per week in order to be able to meet up with the requirement to get to 6.6 million Massachusetts residents by September 1st, which I think should be a goal, considering that we want kids to go to school, we want things to sort of return to normal, whatever that is. But in any case, it's a simple math exercise. What we need are 12 Gillette Stadium scenarios working at full capacity by September 1st. It's not going to happen. But we could get there, say, the epidemiologists say that there's an 80% need to get to herd immunity. we could get to it. But we really need to have a lot more capacity, a lot more infrastructure in place very quickly.
I want to talk about some of your other ideas, both of you, in a second. And by the way, the governor has proposed, I think it's 7, 8, or 9 mass vaccination sites that should open in fairly short order. But before we get to what your suggestions are as to how we alter what we're doing, Doctor, starting with you, why are we doing as poorly as we are? We're 32nd in the nation, as according to the Washington Post listing that we see every day. We roughly 1/2 of the doses that have been sent to Massachusetts, only 1/2, have been injected into people's arms. Why are the numbers as low as they are?
Well, I think this has something to do that's predated the pandemic, to be honest with you. I mean, listen, we have an understaffed, underfunded public health infrastructure that has been there long before the coronavirus arrived on these shores. And that is a large reason why we've been unable to vaccinate the people that we need to do. And my hope is that moving forward, when we get over coronavirus, that we invest heavily in this public health infrastructure. Because I think moving forward in the next couple of weeks, couple of months, I mean, it's going to be increasingly more challenging, I think, to get the vaccinations out. Because right now the focus has really been on hospitals. I mean, 2/3 of the vaccinations that have gone out to hospitals where there is some infrastructure. At Boston Medical Center, I got my 2 vaccinations over the past couple of weeks, and things went as smoothly as could be. But my concern is moving forward as we begin to go to phase 2, phase 3, how that process is done, making sure that there's a central registry, making sure that we have all hands on deck, National Guard, you name it, not just the big sites, but the small sites as well, and making sure equity is at the center of all this.
Well, Doctor, I don't think Mayor Lou Sutter, as head of Health and Human Services and coordinating the COVID response in the state for the governor, thinks it is going as smoothly in hospitals in the state. Here's part of what she had to say yesterday.
We have distributed 651,875 doses of COVID vaccine to providers in Massachusetts. It represents more than 98% of what we have received directly from the federal government. This week, hospital systems did not receive additional vaccine inventory. They need to utilize what they have in hand. And if we must, we will redistribute these fragile vaccines to other providers.
Well, Doctor, it seems to me that what Mayor Lou Sutters is saying is the logjam is the hospitals.
I was referring to my particular experience as one individual.
No, I understand that.
You're absolutely right. I think if you look at what other states are doing, they're really mandating that folks redistribute vaccines if they're not being used appropriately. I mean, you look at Colorado. I think they've signed a piece of legislation that says if the vaccine is not distributed within 72 hours, well, it's got to go out to somebody else. And that's what we need to do right now to get things, to get people shots in their arms.
Bill, what are the things that we need to do immediately? I know we need to increase the number of doses, but how do we do that? What would you suggest? What are the 1 or 2 things you think the governor should embrace immediately to get those numbers up that he hasn't so far?
Well, I think one of the things he has to do is he has to kind of meld some of the phases so that I know talking to health center directors here in Dorchester, one of the things they talked about was, well, if we had a greater number of people that were getting that vaccine, we could be more efficient about doing it. We could get more people in. We wouldn't have to waste a vaccine. Another thing is we do need 12 sites. We need 12 sites in order to do it at Gillette size, in order to be able to get everything done. So we need the infrastructure in place. I think the other thing that's brought up is that we need more people who are capable of giving the vaccine. Right now we're using protocols that prevent a lot of vaccines from being dosed because one of the things is we're also running a healthcare system side by side. On the other hand, this is a preventable illness. With a vaccine, we can actually prevent death. So this should be the number one priority that we're working on and using the healthcare system to accommodate.
And what I would add is,
Doctor, go ahead, Doctor.
We're in a critical stage in the virus right now. Looks like the second surge is beginning to subside. Infections, hospitalizations, and deaths across this country, and even in my own experience at Boston Medical Center. But what I'm most worried about is this potential third surge coming with this new variant. Here we are, this new variant that is significantly more transmissible, and which could result in more deaths. And if you look at places like Denmark that have had a significant lockdown in place for a while, that over the past week or so, they've had a 70% increase in infections. And we just heard that the Brazil variant has reached our shores. So the next couple of weeks, couple of months could be very challenging for a healthcare system.
Well, speaking of that, does that, as the numbers have gone down, and you're totally right, in the background is that variant, Doctor, both the governor and now the mayor have loosened restrictions based upon those numbers. Positivity rate down, number of cases down. Are their behaviors premature in your estimation, Doctor?
Well, I would be very cautious in terms of how we begin to roll back these restrictions. I think right now the focus has got to be on vaccinations. I mean, it's a race between how many people can we vaccinate before the variant is here and it's made itself home in Massachusetts. I mean, all epidemiologists, not all of them, but most of them predict that by March, the UK strain will be the predominant strain in Massachusetts. And that's worrisome to me, not just as a policymaker, but someone on the ground, on the front lines, who's the surge.
You know, Bill, the governor has gone out of his way to mention, and he did it at a press conference yesterday with Michael Curry from the NAACP and community health centers, how high a priority communities of color should be. Both of you have spent your careers in those communities. Bill, with you, are those promises being met in your estimation?
Well, apparently the doses were granted. The bigger problem here is that we know that in low-income communities that patients are more likely not to keep their appointments, and this has been a problem. So we've had health center directors that are asking to be able to broaden their ability to give doses out to people that are not ranked in order right now. And so that's something that has to happen right away. And I think, they certainly are very well aware of the fact that the way to get a vaccine to low-income communities is through the health centers, and that's absolutely true. But they also need to deal with the reality that there's a huge population out here that needs the vaccine, and we got to get it out there quickly. So that there's 427,000 unused doses as of Sunday.
And it's more than just about the number of doses dedicated to communities of color. I mean, it's significantly more complicated. There are communities, Black and brown communities, that have hesitancy when it comes to getting the vaccine. And so we have to be making sure that we're using cultural brokers, community leaders, and get them trained, activated, motivated to make sure that folks that look like them are taking the vaccine, and that letting them know that it's safe, and that, if we're going to get our country and our city back to normal, that we're going to have to get herd immunity, and that's through vaccination.
Yeah, I agree.
Doctor, I want to speak to you briefly, if I can. I only have 30 seconds left in your state rep hat. Places like West Virginia, that's the 5th poorest state in the country. We're the 4th wealthiest. Have a pre-registration system where you pre-register, they notify you when you're eligible, they tell you where to go, or where you can go, they make an appointment. Why is one of the wealthiest nations in the country not have that system that even West Virginia has? Quickly, if you can.
Well, I'll tell you this, that there's a concern amongst not just the legislators, but the public at large and my colleagues in the medical profession that we're not doing enough here. And what I can tell you is that in meetings with legislative leaders across the realm, that we want to see this move as fast as possible. And we're willing to partner with anyone, the governor on down, to make sure that we can become like West Virginia. And it's sad to say that we're there, and make sure that folks get vaccinated as quick as possible.
John Santiago, Bill Wolzak, thank you both for your thoughts and your time. Appreciate it.
Happy to be here.